If you received one of the letters that the Social Security Administration just mailed, do not ignore it. It contains important information about your benefits. I am going to explain in detail what this letter is about and how to respond if you get one. And then there's breaking news coming from the Social Security Administration. Starting in a few days, they're about to implement major changes to their system that is going to affect how you access your benefits. Now, for some reason, they did not send out letters regarding these changes they're about to make on April the 15th, but I have the details and I'm going to bring it to you. Stay till the end of this video because I also have important information for those on Medicaid. There's about 72 million Americans on Medicaid, and millions are about to lose their benefits because Congress, as we speak, just passed an deep cuts to Medicaid. $880 billion is going to be cut from the program that is going to knock off millions of Americans of their Medicaid benefits, including millions of seniors that rely on Medicaid to pay for their Medicare costs and more. I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I have been creating content to help seniors get the retirement benefits they deserve. I started creating websites on Social Security, food stamps, Medicare, Medicaid, and now we are doing video. I am also an adjunct professor. I teach entrepreneurial finance to graduate students at one of the most prestigious universities in the United States. If you're new here, please subscribe, hit the like button because we appreciate your support. And then, as always, I want to know where you're watching this broadcast from. So go in the comment section and give me your city and your state. So let's dig in. So, what is this letter about? This is an important announcement that you cannot miss. So, let's get to it. The Social Security Administration is sending letters to beneficiaries who were overpaid, notifying them of a need to repay the excess funds. Some of this overpayment was the fault of the Social Security Administration. But by law, even if they make a mistake, you are still responsible. So when you get one of these letters, do not ignore it because it is serious business. These letters explain the new repayment policy that went into effect on March the 27th. Overpayment occurs when the SSA pays you more than you should have received, often due to unreported income changes that happen or calculation errors, benefit calculation errors that the Social Security Administration makes, and then you are on the hook for it. The letter you're going to get is going to outline the amount owed and the options that you have to pay it back right away. For overpayments after March the 27th, the Social Security Administration, this is where things get really, really, really scary. They are going to withhold 100% of future benefits until the balance is repaid. This replaces the previous policy of withholding 10% per check. This is a big deal. So it means that if you get one of these letters and you owe money after March the 27th, they're going to stop sending you your Social Security or disability SSDI check. And then they're going to use that money to repay everything you owe until you pay it back. If it takes months, you're not going to get your benefits. If it takes years, you're not going to get your benefits until they've repaid everything back. That's why I wanted to bring you this news because this is critical information. If you receive a letter, you can appeal the decision or request a waiver. A waiver means that financially you cannot afford to pay it because if you pay this money, it's going to cause you serious financial challenges. Or you can contact the Social Security Administration for assistance to promptly pay or avoid disruptions to your benefits. So as you can see, this is some big, big news here. So what is overpayment and how do they happen? Well, overpayments occur when the Social Security Administration pays beneficiaries more than they are entitled to, often due to unreported income changes or calculation errors. These mistakes can happen even if the beneficiary is not at fault. So how big is this issue? From 2015 to 2022, Social Security Administration made nearly $72 billion in improper payments, primarily due to overpayments, accounting for less than 1% of total benefits they paid during that period. So about 1% of all the money that they pay out during this 7-year period were due to errors or improper payments. So it's not a big number, but it is, because $72 billion is still a big number. And as of September 2023, the latest information we have, they have not yet collected $23 billion of that $72 billion. So why does this matter? Because overpayment recovery policies, impact millions of beneficiaries, which I'm going to talk about why they are making this new change from only collecting 10% from your Social Security check to collecting 100%. Why did they do that? Why are they doing that? What is motivating them to do this? So starting March the 27th, the Social Security Administration will now withhold 100% of future benefits until overpayments are fully repaid, replacing the previous policy of just taking 10%. This applies to any new overpayments that happen after March the 27th. So if you already have a payment plan for overpayment, then you are exempt from this. This is going to apply to new overpayment. So if you receive a mail from now on telling you that you owe money, then it means you fall under this new policy. So pay attention to what you can do once you get this letter. Now, those affected will receive no monthly check until their balance is resolved, creating a significant financial hardship for many seniors and disabled individuals. There are exemptions, though, and it only applies to SSI recipients. Supplemental Security Income beneficiaries remain under the previous 10% plan. So even if you are on SSI and you get into an overpayment situation starting March the 27th, you will still be under the old 10% policy. Social Security Administration sends overpayment notices at least 30 days before starting recovery actions. And I'm going to talk about why it is important for you to appeal. If you're going to appeal this decision, it's important for you to appeal within 30 days instead of the 60 days that the letter tells you, and I'll explain why. So how can you respond to an overpayment letter? Well, beneficiaries can repay. That is one option. Your overpayment by credit card, online bill pay, or check. You can do so online or call the Social Security Administration. The web page that I'm showing right now is from the Social Security website. It is the website or the web page on their system that shows you how to pay the money back within 30 days. Now, not a lot of people have money to pay tens of thousands of dollars in overpayment right away or in 30 days that the Social Security Administration is requesting. So you have other rights. You can appeal. Recipients can appeal the decision or the amount of an overpayment if they believe it is incorrect or unfairly calculated. Appeals must be promptly filed after receiving the notice. So this is one way to respond, is to appeal, or you can request a waiver. A waiver is a different form of appeal. If you cannot afford full recovery, it means that if they take even a little bit of your Social Security check, is going to cause you severe financial hardships, then you can send them a waiver request. And it's essentially saying, I cannot pay this money. I owe it to you, but I cannot pay it. So if you cannot afford full recovery and believe the overpayment was not your fault, you can request a waiver by contacting Social Security or filling out Form SSA 632. Now, how can you avoid getting into this situation? Well, I'm going to talk to you about things that lead to overpayment. Now, why is the Social Security Administration changing from the 10% to 100%? Well, Doge is involved here. Elon Musk and his Doge are putting in strict requirements to make sure that they root out fraud, waste, and abuse. And I think they are looking at this Social Security overpayment in part as fraud, in part as abuse, and in part as waste. So it checks all three categories. And that's why they are pushing the Social Security Administration to go back to their 10% rule. The Social Security Administration estimates that they're going to recover $7 billion in overpaid funds over the next decade under the new policy. In the meantime, they are also cutting staff. So when you call them to deal with your overpayment issue, you have to be patient because they just cut 7,000 workers and are planning to do more. They're closing almost all their regional offices. So it's going to be very hard. And Social Security customer service is going to take longer than you're probably used to. Now, here's some historical context. The full withholding policy was previously used during the Obama administration. When Obama was in office, they were collecting 100%. When Biden got in office, there was a huge backlash from Congress that the 100% was unfair. And so they cut it back to 10%. And then Trump is now bringing back the 100% due to demands by Elon Musk and Doge on how to root out fraud, waste, and abuse from the system. So, how can you avoid overpayment? Well, if your monthly benefit increases unexpectedly outside of COLA, outside of your cost of living adjustment, contact Social Security Administration and find out why. Do not just take the money and run. In other words, do not just pretend that, hey, my Social Security or disability benefits just went up. I don't know why, but I'm going to spend the money. No. Call them and find out, because even if they made a mistake and paid you more money than you deserve, you cannot go back and say, hey, it wasn't my fault. You gave me the money. You should know better. They don't care. They're going to hit you with an overpayment, and they're going to stop you from receiving your benefits, and they're going to use your money to pay it back until it's all paid back. Report any changes in income, marital status, and resources promptly through the My Social Security account or by calling the Social Security Administration. And understand eligibility rules. Familiarize yourself with Social Security rules for your benefit type. If you're getting retirement benefit, disability benefit, SSI, make sure that you're in compliance, especially when it comes to work. If you're working and receiving benefits, in all three categories, there are rules. SSI, SSDI, retirement benefits. If you're receiving retirement benefits before your full retirement age and you're working, you have to pay attention to the earnings test. If you're getting disability benefits and you're working, or you're in the trial work period, you have to pay attention to the substantial gainful activity threshold. If you ignore those and keep making money and not reporting it appropriately and getting your benefits adjusted accordingly, then you get into an overpayment situation. Regularly check your benefit statement and reach out to Social Security Administration with questions about payment accuracy or eligibility requirements. Now, what should you know about all of this? Well, the first one is that the new policy could leave some beneficiaries without income for essential expenses like housing and food until their balance is repaid. Contact the Social Security Administration if repayment creates undue hardship, because they are authorized or empowered to give you some relief if this is going to cause you undue hardship. Critics warn that stricter recovery measures could disproportionately harm vulnerable populations like low-income seniors and disabled individuals who rely on Social Security benefits. Remember, 40% of all seniors get Social Security as their only source of income. So this is serious business. Previous media coverage highlighted cases where aggressive recovery actions led to severe consequences for beneficiaries, prompting the change that I told you about to the 10% that happened in 2024. If you receive an overpayment notice, act quickly by appealing or requesting a waiver to minimize disruptions. I remember I told you appeal in 30 days. Well, the Social Security Administration, once they mail you the letter, after 30 days, if you don't pay the money, they will start collection, which means that they're going to stop your benefits. But if you send them an appeal within 30 days, they are required by law to hold off on all collection efforts and then deal with your appeal and make a decision on the appeal before resuming any collection effort. So that buys you some time to figure out what you're going to do. Now, let's talk about April the 15th or 14th. It's actually the 14th, but the rules go into effect on the 15th. So, the Social Security Administration is implementing these rules that are going to change the way you interact with them and the Social Security Administration when it comes to your benefits. These major changes are critical for beneficiaries to understand, ensuring that they face or don't face unexpected interruptions to their benefits. The new in-person identity verification rule will take effect on April the 14th. It was supposed to start on March the 31st, and they pushed it back. But it's happening. If you haven't received a letter about this, you are not alone, because they did not mail any letters like they usually do. Why? Part of it is because they've laid off a lot of people, including the communications team, And so they are moving ahead with these changes without even telling beneficiaries that these changes are happening and how they are going to affect your benefits. So, what is this rule about? Well, there are several categories of people that are affected, and there are some categories of people that are not affected. So, let me explain. Retirement and survivor benefits applicants must verify their identity in person if they cannot do so online. This requirement aims to reduce fraudulent claims but could place a burden on those without internet access or those having difficulty traveling. Now, starting March the 27th, I already told you there is the overpayment issue that is happening also. And then they're also reducing staff in the meantime. So, who is affected by this new ID rule? Well, those applying for retirement benefits or auxiliary benefits like survivor benefits must verify their identity in person if online methods fail. The new rule adds a layer of complexity, especially for those unfamiliar with online processes or who lack reliable internet access. Now, if you are in an overpayment situation, remember, starting March the 27th, unless you're on SSI benefits, it's going to be 100% recovery. But there's more. There's more changes coming. If you're on SSI, expect more scrutiny to your benefits. Even SSDI beneficiaries are going to see more scrutiny on their disability benefits because I think Elon Musk and his Doge team believe that a majority of disability beneficiaries are fraudulent. And so they're going to put a lot of heat on disability beneficiaries to prove that they're disabled. If you have a redetermination audit, it's going to get more aggressive. They're going to ask for more documents. So get ready so that you can avoid any disruptions to your benefits. Now, who is not affected by these ID verification rules? Well, if you're applying for Medicare or disability benefits, you do not have to go through the online system to verify your identity. And then if you're on survivor benefits, they may exempt survivor beneficiary applicants from this new rule. That is still under consideration. So until then, if you're applying for survivor benefits, you still have to go through the ID verification online. There is only one category of people who this does not affect at all. If you're currently receiving Social Security benefits and everything is okay with your benefits, you do not have to make any change to your direct deposit, your address, your personal information, then you're good. You don't have to pay attention to this. But if you have to do so or make changes in the near future, you are going to be required to follow these new guidelines. Now, if you're currently receiving benefits, when do you have to go into the office if you cannot verify your identity online? Well, there are two special scenarios. The first one is if you're going to make a change to your direct deposit starting April the 14th, you have to verify yourself online. If you can't, you have to go to the office. And then, if for whatever reason you were asked by the Social Security Administration to verify your identity and you cannot do so online, you have to go in person to do that. So, how do you prepare? Preparing to avoid in person visits. If you don't want to go to the Social Security office because of all the changes that are happening, because of the layoffs, because customer service is going to be not very pleasant, because they are going to be backlogged. And then if you go in person, it's going to take a while to get services because they're short staffed. So if you want to avoid all that, there are things you can do now to get ahead of that. Number one is to create a My Social Security account online, verify your ID through login.gov or id.me, and then you can get access to your benefits and then you can transact most services online. There are many, many Social Security services that you can do online that a lot of people do not know. So get online access and you'll be quite surprised by the many, many tasks you can perform online without having to go in person to a Social Security office. Of course, update your information online now, and then you can opt to receive online notices if you are tech savvy and you rather receive notices online rather than getting it in the mail. That is also an option. Now, what do you have to do before April the 15th? Well, create an online account, as I have just mentioned. Update your direct deposit information if that's what you're planning to do. Otherwise, once April the 15th comes, you have to go through doing so under the new rules. And then, if for whatever reason you are frustrated with the Social Security Administration because they are treating you unfairly, or they are dragging their feet, or something that you need for your benefits, or you need your benefits, and through the application process, things are taking longer than they should, you should reach out to your elected officials, your congressperson, your senator. They can write to the Social Security Administration and get you faster responses because, believe it or not, when the Social Security Administration hears from Congress, they respond fairly quickly. And before we get to Medicaid, I've told you millions are about to lose their Medicaid benefits. That is coming up. I'm going to explain that in detail. Stay tuned. But let's talk about Medicare for a quick second. If you are turning 65 this year, or if you're already on Medicare, but you're not happy with your plan, or you think you could be on a better plan, I have great news for you. First, there's a lot of changes that are happening with Medicare that are really scary for seniors. People are being dropped from plans, hospitals are dropping Medicare plans, etc. In some states, it's even more scary because, example, in Oregon, 25% of plans are leaving Medicare coverage. In Minnesota, seniors face Medicare dilemma: stick with doctors or health plans. There's a lot of this kind of news going around. And then this article from the Center for Economic and Policy Research: 34 million seniors in Medicare Advantage plans face rude awakening. What is this about? Well, it's because of confusion around Medicare. There are 24,000 plans. How do you sort out what plan is good for you, good for your budget, the coverage you need, the doctor networks you need to be in, etc., etc.? Well, that is why it has come out that 90% of all seniors are in the wrong plan. And if you're in the wrong Medicare plan, it's going to cost you. On average, a senior couple spends about $300,000 on Medicare during their retirement, and it can affect your health. There is nothing worse than needing Medicare coverage for a specific thing you need, and you find out that your coverage or your plan does not cover that particular thing. And so, how do you get into a good plan? Well, we have partnered with Chapter Medicare. Our friends at Chapter are an unbiased free service that helps you find the best Medicare plan that fits your needs. Here's the thing. One of the reasons why we are partnering with them is because they are the only Medicare advisory company with access to all 24,000 Medicare plans. So they see it all. They can see what's in your local area, what is in your state, and offer you options on what suits your budget, your needs, the care that you need, the drugs that you need to be on, etc. And another reason why we like partnering with Chapter is that their licensed agents do not work for commission. So when you work with them, when you get on the phone, they are going to help you, and their sole mission is to help you find the best plan. They are not there to sell you the most expensive plan so that they can make the most commission. And that is one of the reasons why we like working with them. And then the third is they can save you money. We all like to save money, $1,100 a year on average. So do not delay. Call Chapter today, 539-205-2147. These guys are the real deal. If you're turning 65 and you need to get on Medicare, or you're on a plan you're not happy with, or you just want to look and kick the tires and see, can they get you in a better plan? There is nothing to lose. There's no downside to this. Call them or go to the description in this video. There is a form you can fill out, but you have to act quickly because there may be a small window that allows you to make changes, and you want to do so very quickly. They are highly rated by the Better Business Bureau, A+ rating, lots of 5-star reviews. The next time I do this video, I'm going to bring you some of the reviews. I mean, my mind is blown. These guys are the real deal. Check them out. Call them now. Now, let's talk about Medicaid. The House of Representatives just passed a giant bill that is going to gut Medicaid, throw millions of people off the plan, and Republicans clash over Medicaid to hunt for money to pay for Trump's tax cuts that he wants to extend. So let's talk about it in details. Republican leaders recently pushed through a budget blueprint that could lay the groundwork for major spending cuts. This plan aims to deliver President Trump's agenda of spending and tax cuts by potentially cutting $1.5 trillion in the federal budget over the next 10 years. The House passed a budget plan in February that asked the committee that oversees Medicaid to find $880 billion in cuts. This has become the most contentious issue in the budget negotiations, with several Republican senators publicly expressing concern. While the House is pushing for deep cuts, many Republican senators have made it clear they do not want or do not have the appetite for such severe reductions. This inter-party conflict has become increasingly public as the budget resolution moves forward. There's a huge concern about rural beneficiaries being impacted in overwhelming numbers. Several Republican senators, including Jerry Moran of Kansas, have warned that Medicaid cuts could threaten struggling rural hospitals. Senator Moran noted that hold on a second, let me go back. Um, the average hospital in a rural area relies on Medicaid a lot, and a lot of people don't know that. But as he's saying, the average operating margin for hospitals in Kansas is already negative 7%, with 8 Kansas hospitals closing in the past 10 years. And a lot of rural hospitals rely on Medicaid because a lot of rural patients are on Medicaid. So if you got Medicaid, you're essentially getting a big source of income for rural hospitals, and it's going to force more of them to close down. So who is affected by these cuts that we're talking about? Medicaid is a public health insurance program that covers more than 70 million people, primarily those with low income. In some states, like West Virginia, nearly 28% of the population is enrolled in Medicaid, making cuts potentially devastating. Medicaid payments provide a crucial financial buffer for struggling rural hospitals that often face higher levels of uncompensated care. Senator Moran warned that rural communities' future disappeared in the absence of having access to healthcare. Republican senators like Susan Collins of Maine have expressed concern about cuts affecting low-income families, disabled individuals, low-income seniors, rural hospitals, and other healthcare providers. These groups rely heavily on Medicaid services. And a poll conducted by Fabrizio Ward, president of President Trump's chief pollster, found broad disapproval of cutting Medicaid, including among voters who backed the president in 2024. This suggests cuts could have political consequences for Republicans. Now, what's driving all of this? House conservatives, including Representative Chip Roy of Texas, are pushing for vast cuts to federal entitlement programs. Roy only supported the compromise budget after being assured by President Trump and party leaders that the final product would include substantial Medicaid cuts. So he's been assured by the President Trump, that the final budget is going to include substantial cuts to Medicaid. Guys, this is the news. This is the facts as they stand. When they tell you something of what they're going to do, believe them. Several Republican senators have expressed opposition to Medicaid cuts, including Josh Hawley of Missouri, who stated, "I am not going to vote for Medicaid benefit cuts." Senator Susan Collins of Maine, Lisa Murkowski of Alaska joined Democrats to support an amendment that would have eliminated Medicaid cuts from the budget. Republican leaders pushed through a compromise budget plan that reduced the specific Medicaid cut requirement, asking the Senate to find only $4 billion in reduction over the next decade instead of $880 billion. The compromise has not satisfied either side of the debate. Now, what's the president's position? Mike Johnson claimed that President Trump would not endorse cuts to Social Security, Medicare, and Medicaid. "We are going to protect the benefits that everyone is legally entitled to. However, some Republicans believe cuts are necessary to achieve the overall budget." So that's where we are. We don't know which one what is true, because they want 880 billion. The president doesn't want to cut Medicaid and Medicare and Social Security. but they want to get 1.5 trillion to fund the tax cuts. You cannot find 1.5 trillion dollars in the budget without cutting Medicare, Medicaid, and Social Security, or one of them. It's impossible because that's where 40% of the federal budget is. So, financial implications. Republican leaders acknowledge it will be nearly impossible to reach the $1.5 trillion in spending cuts without touching Medicaid. It is a fact. Speaker Johnson suggests imposing work requirements and addressing waste and fraud. But I mean, even Elon Musk, who came in hot at the beginning of the Trump administration, he was going to cut $1.5 trillion. And then he, he toned it down to $500 billion. Yesterday, he came out and said he can only find at best 150 billion. So that is how hard it is to find what they are calling the fraud, waste, and abuse. There is this impression that the whole government is riddled with fraud, waste, and abuse, when the actual truth is that there are services that people rely on, that people have a false impression that majority of those services are fraud, waste, and abuse. When you go kick the tires, you realize that it's actually human beings behind those services that need them. Medicaid is jointly funded by the federal and state governments, meaning federal cuts will likely force states to reduce services or eligibility or find other funding sources, which is not going to happen. This could place additional financial pressure on already strained state budgets. In rural areas where incomes tend to be lower and uninsured rates are higher, hospitals often face significant uncompensated costs because people come in and they don't have money. So the hospitals treat them anyway because they are required to, and then they don't get paid. So Medicaid is one of the areas that they rely on to get paid. Medicaid helps address this gap, and cuts could force more rural hospitals closures beyond the already 8 that are closed in Kansas. Some Republican senators have indicated they might support limited changes like work requirements for able-bodied adults who do not have preschool children, but not broader cuts that will affect benefits for vulnerable populations. So what does this mean for seniors? What should you make of all this? Why should you care? Well, the budget resolution has passed both chambers, but the specific cuts will be included in the final legislation, which remain undetermined. Republican leaders must now work to reconcile the gap between the House and the Senate, and this will continue to unfold over the next few months as the committee work to identify specific cuts and draft the legislation. Pay attention to statements from your state senators and your representatives on these issues, because this is going to affect you directly if you're on Medicare or you know somebody in your family who is low income, probably on Medicare, because there are 72 million people on Medicare, even more than the number of people on Social Security. While no changes have been implemented yet, seniors should stay informed about potential changes to Medicaid that might affect their healthcare coverage, because here is the fact: 30% of all seniors on Medicare are also on Medicaid. Why? Because low-income seniors who cannot afford their Medicare premiums and out-of-pocket costs rely on Medicaid to pay those costs on their behalf. So remember, 30% of all seniors on Medicare are also on Medicaid. So that is really what I wanted to share with you today. If you like what you heard, hit the like button, hit the subscribe button, and stay tuned, because we're going to bring you all the latest news and updates, anything in and out of Congress that is going to affect your Social Security, Medicare, Medicaid, food stamps benefits. We want to be the first to bring it to you. So thank you for watching. If you have any comments, let me know below in the comment section. And until the next video, thank you for watching.